One of the questions I'm very frequently asked by patients who are considering breast enhancement is, will they be able to breastfeed after the procedure is done? That's especially a question in the younger patients who haven't had any children yet and are interested in maintaining their ability if possible. First off, got to realize not everyone is made for breastfeeding. Some people are just not able to. It could be due to the anatomy of the breast or the quality of the glandular tissue. Sometimes inverted nipples can have a big say in that. And sometimes you can have all the perfectly normal tissue and it just doesn't do it. So realize going into it right away that even though you may do some intervention on the breast, that very well could not be the reason that you have a problem with it, or you may be able to do it just fine. The factor that we consider most important is how much violation of the tissue that we do that would interfere with breastfeeding, because breastfeeding takes action of the glandular portion of the breast being attached to the ducts that go up to the nipple. And if we interfere along that line, then it's probably less likely you'd be able to. With an augmentation, if we go in through an incision through the fold of the breast, we actually avoid the breast tissue and don't distort that at all. We just go straight underneath the muscle, create a pocket for it there, and all of that anatomy is still intact. And so the likelihood of changing your ability to breastfeed is really very minimal with that. If we have to do a lifting procedure too, it changes things a little bit, because we do have to do some incisions into the tissue, but we don't go deeply in the tissue. We kind of rearrange things on a more superficial level, and there's a lot of the breast tissue where the ducts and the glands and the nipple are all still intact and therefore should function normally. One kind of a guideline would be, if you've had a child and you were able to breastfeed, you probably will be able to again. If you had one and weren't able to, we're certainly not going to help that process. It is a consideration, but like I said, most of the time it doesn't make a big difference in your ability to or not.